Hello, ladies and gentlemen. Welcome to Triple N Media. Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we are going to look at ChatGPT and artificial intelligence and its infinite medical applications. Really? We'll find out. Anyway, so we are going to focus upon ChatGPT, which is generated by OpenAI. ChatGPT has taken the world by storm in that it was just introduced in November 2022, and in a span of 3 months, it has more than 100 million subscribers. Right now, ChatGPT is free for public to test it out, and in the process they are collecting billions and billions and bits of information about every field you can imagine in the world. Anyway, we're going to focus upon the healthcare industry. Since I am a cardiologist from Houston, Texas, I want to see how ChatGPT and other artificial intelligence programs can help with the healthcare industry in improvising quality of patient care, minimizing risks, reducing drug reactions, and a whole host of other things, plus automation of many mundane tasks like getting authorization, discharge summaries, and a whole host of things. So let us begin with the main presentation. And what is ChatGPT after all? It is an artificial intelligence language. It is a chat generative pre-trained transformer. It gathers a lot of information about a particular field from billions of sources, and then it accumulates that data, and when someone poses a question, it goes through his database and comes up with a beautiful descriptive text explaining answers which is very specific to your question. As opposed to when you pose a question on Google, it shows a bunch of ads, it shows a bunch of websites, but here it pinpoints answers to your questions. The first question we want to ask is how reliable are the chat responses for the medical field? Since I'm going to be focusing on the medical field, I started off with the first question, which is how reliable is ChatGPT answers? And before I go any further, I want to tell you this entire presentation was generated. I'm talking about the text for this presentation was generated by ChatGPT. And you will see as we proceed that every point that I'm going to be talking about was generated by ChatGPT. That's the beauty of this ChatGPT and artificial intelligence languages. Coming back to the main question, how reliable are the ChatGPT answers? It clearly says this is not this is just for general information. This is for your knowledge expansion, but this is not a medical advice. This is not going to diagnose your medical problem and write a prescription to the pharmacy to get the medications. That's not what the purpose is. The purpose of this is to automate a lot of routine things or do things which a computer can do versus having a person doing it. For example, doing appointments or getting authorizations for a CAT scan or a nuclear stress test or an MRI, things like that, or appointments. These are the things that ChatGPT can really automate specifically for your entity, and that's the beauty of it. ChatGPT can answer medical questions. You know, a lot of times when patients are discharged, they give you like 100 pages of drug description and all these things. But we don't need to, because if you just give the list of the names of the drugs, then they can put on your website, you put a link to the ChatGPT, and the person can type in the name of the drug and ask a series of questions. Okay, what is this drug? What does it do? What is the dosage? What are the side effects? And you can get all those answers in an interactive manner versus going through billions of pages of fine print trying to find answers for your specific question. In this way, it saves time for you. And those are some of the things. ChatGPT is not perfect. Medical professionals think it is not ready for prime time, and I agree with most of their assumptions, but I'm one who looks forward to futuristic life, futuristic technology, because that's where we were like 30, 40 years ago when Apple came up with Apple II computer. Remember, I started off with Apple III computer. I wrote a software for medical billing in 1982, and look where we are today. We are paying $1,000 for a handheld device called iPhone, which is a full-fledged computer with infinite possibilities. So let's keep an open mind and see. So that's why I use ChatGPT to ask all the pertinent questions to see how good are you in your application in the medical fields, in what areas can you help us, and how it can be implemented. And let us go through this and see what we can learn. How can ChatGPT help in the medical field and patient care? That was my next question, and it came up with some good suggestions. It can clinical documentation. I hope you can follow my arrow. Clinical documentation, and it can professionals generating reports, summaries, medical records. So the important thing, which I'm going to focus in the later part of this presentation, is how to generate a discharge summary from a patient chart. There are patients who are in the hospital for 3 days, and there are patients who are in the hospital for 3 months. And some of their charts may be like bigger than 2,000 pages. How do you summarize that? It takes an enormous amount of time and effort for doctors to go through the chart, dictate it, and transcription services are pretty expensive, and you have to review that, and then you have to sign it before the hospital can collect money from the insurance companies. So this is a big challenge. Any delay is lost money for the hospitals, and that's why the hospitals are very particular about getting doctors to do the discharge summaries on the day the patients are discharged or within 30 days. So we'll come back to that. Let's look at some of the other applications, and like documentation, medical records. It can generate medical records, and patient communication. And of course, a patient goes home and a patient has a question. You gave me this medication. When am I supposed to take? And all these things. These are general. Again, it is general information. It is not a specific recommendation for you or for your family. Keep that in mind. And it can also set up appointments and help with your insurance claims. And I talked about getting authorizations for tests like CAT scan, MRI, X-ray, and it can also help in medical triage. In an emergency room where people see like 100, 200 patients, these people can go to kiosks. Remember the kiosks? Everybody hated those kiosks to check in, but in every VA hospital we go, there's a kiosk there. First, you have to check your identity and your appointment and all these things on a kiosk before you can even talk to a person. So we are coming to a stage where there's going to be kiosks where you key in all your symptoms, date of onset, your medications, and your medical history, and based on that, the ChatGPT can determine the severity of your disease. That can signal the hospital staff as to, okay, this patient has a medical emergency, this patient is having a possible heart attack, or this patient is possibly having a stroke. I'm just exaggerating, but I'm just giving you an idea how it can help. And these are areas which can help because you still have human interaction, because if one person is at the top of the list, that person needs to be seen first, versus a person with a splinter in a toe which can wait a few minutes extra. Okay, that's keeping in mind and provide tea. And about drug, and I already mentioned about drugs. So what I did was, as I said, the entire presentation was generated using ChatGPT by asking pertinent questions. So I started digging deeper into this project and see what we can come up with appointments. It can look up the calendar and see what dates and what time slots are available, and it can make the appointments for you. It can send reminder letters. It can remind you of your timings. It also reminds you of what are the things you need to bring when you come to the visit. So a whole host of things can be built into this artificial intelligence program. Then let's talk about discharge summary. I'm going to expand on this one at the end of this presentation, but I'm just telling you, as I said, you have to go through hundreds and hundreds of pages of chart to come up with a summary. That's a pretty daunting task. Even then, it is not complete. Whereas ChatGPT can go through those 1,000 pages of information and come up with the summary, which may be pretty close to or better than what we can do sitting at the computer looking through 1,000 pages on an electronic screen or a computer screen and dictating the report. The other thing is the same principle can be used in scientific research. Again, in scientific research, we have thousands of pages of data information collected, and that has to be translated into a text for discussion and for summaries. And that can be generated by using this artificial intelligence, one of which is ChatGPT, which is produced by OpenAI. So here's a discharge summary that can be produced, and I'm going to dig deeper into this topic in a minute. Let's look at what other. It can also generate mass emails. Say you have 5,000 people in your area. You want to tell them that, okay, the COVID booster doses are available at this time, and if you want to get your booster dose, click here. That will take you to the appointment section. Then in the appointment section, you make your appointments. Then it will tell you what are the things you need to bring. Make sure you bring your COVID vaccination card that you had from the previous vaccinations, and a whole host of other things. All these instructions can be built into the system, so it is very interactive. Most websites are just one-sided information, whereas ChatGPT can be highly interactive to an individual's need, and that's what I think is making it different with artificial intelligence compared to static websites and automated telephone calls. Can ChatGPT help with medical triage? I already talked about this. When you have 200 people coming into the emergency room, you had to talk to everybody and you have to decide who needs what level of care. Whereas if these people go to these kiosks and input all their data, then it will rank all these patients based upon their severity and urgency, and that may help to expedite things, especially in a sicker patients. Medications. You go home and you don't know what medications you have other than the name. You say, what is losartan? Okay, you put your question, what is losartan? Losartan is a blood pressure medication belonging to a class of angiotensin receptor blockers. It is used to reduce the blood pressure. I say, okay, what is the dosage? And you can ask a series of questions and you get pertinent answers. You don't get any commercials, you don't get any advertisements, you don't get any links to 100 websites and try to dig through the product information. Even as doctors, we don't have time to read that like 5-point print of drug information. We just collect the main information. But here it says losartan is a high blood pressure medicine, 50 milligrams once daily. It can be given 25 milligrams daily, patients requiring smaller doses. That's a good information. Then you can put another question. What are the side effects of losartan? In that way, you keep asking questions. The more you ask, the more information you get. And this is knowledge and information. This is not a recommendation. Again, I keep repeating that. Okay, let's talk about how can help with appointment and scheduling. I already mentioned about this, and as I said, all of this was generated by ChatGPT. I didn't write a single line of text, nor do I have like a pre-printed screen here I'm trying to read. I'm just talking right from my head, just after having done these questions through the ChatGPT. It can look at the appointment slots that are open for your particular field, for your particular problem, and see if your doctor is available. Then it can mash those things. Then it can send you reminders and a whole host of things, which I already talked to you about that. Then the next question I asked was, how can ChatGPT help with the medical authorization for tests? This is a major stumbling block for the patients, for the doctors, for the primary care physicians, and for the hospitals. Your doctor recommends a CAT scan. Then you have to go for authorization. Then it has to be, the one lady has to literally enter this into the computer or call a person and get the authorization. There's a tremendous amount of labor intensive process involved here. Whereas if you input all this information from the information given already by the patient, given by the primary care physician, and when all these things are input and that information is transferred to the insurance company using the ChatGPT or any artificial intelligence, then the authorization can be automated, so that once all the information is submitted, you get the authorization. If there's a question, then you can just focus on those troubled claims versus sitting and trying to get authorization for every test using a phone or any other means. So this is where I think artificial intelligence can help us to automate some of the routine things that can be done by computers and by using artificial intelligence. The biggest chapter which I'm going to focus upon in the rest of the presentation is, for example, hospital discharge summary. So the ChatGPT says, in order for any artificial intelligence to be applied in the healthcare industry, first we have to define what is a problem we are trying to solve. So to me, the most important problem for a hospital, for the doctor, are discharge summaries. Why do I say discharge summaries are so important? Because a hospital cannot bill the insurance company until it has a discharge summary completed. So that one. Number two, the doctor has to finish the discharge summary within 30 days. And even that 30 days grace is a lost time for the hospital in collecting the money. So there is a lot of dynamics involved in this one. And if the doctor doesn't complete the charts, he's going to be put on suspension. That means he can't admit any patients. He can see the patients that are already in. He can see the patients. So there's a whole host of administrative responsibilities involved, which takes time, which is non-productive. Whereas if we can get these discharge summaries automated, imagine how much it can save in terms of labor, in terms of frustrations, in terms of reminders, in terms of suspensions. Okay, how big is this issue? This is the data from the American Hospital Directory. I think the most recent one is like 922. There were 30.3 million discharges in the United States per year. 33.3 million discharges, and I would say 80 to 90% of them need a discharge summary. And it is very time consuming for me as a doctor to sit there and go through a chart, and sometimes we may have like 30, 40 charts we have to complete within a couple of days. So I may be spending a whole day sitting in the record room trying to dictate these charts. Whereas if we can use artificial intelligence to scan through those hundreds and thousands of pages of document, come up with a summary, I basically just look at the summary and make any changes that I need to do and sign the chart. That means this can be done even before the patient leaves the hospital. I'm telling you, this is the beauty of artificial intelligence when it is fully intelligent enough. Let me underscore, when it is fully intelligent enough to replicate the discharge summary that is produced by the doctors. And if it can do that, then it will eliminate these reminders, these delays, and hold up of revenue. And that's where I think it makes a big difference. I said, if I'm a hospital administrator, I would be ready to jump into this project immediately, because this is one area where the hospitals can really expedite things. So let us see. My next question was, how does ChatGPT generate summary from medical records? There are two questions here. It's kind of hard to read, so let me break it down into, okay. ChatGPT can generate summary from hospital medical records. However, the quality and accuracy is based upon how well the ChatGPT model is trained and what pertinent information to look for, like procedures, tests, diagnosis, complications, medications, discharge instructions. We have a basic template for discharge summary, and if all this information is fed into the ChatGPT engine, then it can fill out these blanks pretty easily, and then we have a discharge summary. And okay, can it create a 1,000-word summary from a 1,000-page discharge medical record? it says yes, it can do those, and it can also incorporate graphs and images, but that involves the connection with another software that is provided by OpenAI. And for discharge summary, we generally don't have images unless you add a couple of images of the test that we have done. Like if you get an endoscopy, they may give you a picture of what the polyp looked like when they took it out. So those things can all be done using artificial intelligence, and that's the beauty of the future of artificial intelligence. It is not here today. It may be here. We're going to explore that one too. All right, how is customization for the medical field done, and who are the people involved? I said, okay, I'm the hospital administrator. I want to customize this discharge summary to start with one entity. And how is it done? Who do I talk to? Okay, it says first we need to identify a need. Our need is to generate a discharge summary from the hospital records. Data collection. We already have these 1,000 pages of information in hospital electronic medical records. Then the next part is training these models. What do you look for? What is the reason for admission? What were the initial findings? What tests were done? What procedures were done? What treatment was given? What was the outcome? What were the complications? What were the discharge medications? What were the discharge instructions? This is a pretty standard template, and that can be built into this artificial intelligence, and that can take this information from these 1,000 pages of document and scan it into, and this may also be used for legal cases. You have this 1,000-page document, then you ask it to create a summary. Then looking at the summary, you can look at what are the high points, and it may miss certain points. As I said, it is not ready for prime time from what I have done from my research. Then you know what are the high points, then you can go and explore on those high points in more detail. Then validation is important. Validation means there still has to be an input from a qualified person, like a doctor who is responsible for signing that document. Then implementing, developing, and improvising. And these are all the various steps which is with any other new system. All right. I already talked about it can generate mass emails for any purposes. I asked him, do you have any active field experience at the present time? And he said there are other artificial companies that have medical programs that are incorporated and in practice. I said, that's better. So we are getting closer and closer, because I want to get to see who I talk to and how do we implement this. All right, how do I submit medical records to generate a summary? So that's an important thing, because health records or personal information, we have to comply with the HIPAA regulations. And even I posted that question. As I said, this has to be transmitted through secure servers. The patient information has to be coded, so no personal health information is disclosed to any parties other than the hospital which is receiving the final results. And it customizes. What about HIPAA regulations? As I said, again, ChatGPT has to build into it a secure way of encrypted data transferred from one source to the other and returned back. And even then, the patient identification is only by a number or a sequence of number and digit letters, and not by any other means. Okay, how do I implement? Who do I contact? As I said, this is all generated by ChatGPT, the entire presentation. It says any AI machine language vendor may be able to customize this to your particular needs and implement it to generate discharge summaries. Healthcare organizations may already be using some of this in different areas. You could talk to them and get information as who is providing their artificial intelligence services. I said, this didn't really help me. I really need names. I really need to know companies. So I asked another question. Can you name some companies that are currently providing artificial intelligence applications in the medical field? And here it came up with IBM Watson Health, Cerner, Medtronic, NVOQ, M Model. So these are some of the companies it listed. So I'm getting a little more into reality. So I said, just the names are not going to help me. I need to know who to contact. So I said, how do I contact IBM Watson Health? So it gave me the website, which is too generic, and he said, click on. But this may be too generic because as a medical professional, if I call any one of these websites or 800 numbers, you're not going to get anywhere because they have like 10,000 employees. You're not reaching the right person. The right person you need to reach is who is the sales representative for a given product or a service. And you need to give that person's number and have that person call you. I mean, that's the only way you can find out. If you want to implement a software like discharge summary software, artificial intelligence software, you have to talk to the sales representative representing that entity, like artificial intelligence division, the sales representative for your area. Then you will get the information. So as I said, this helps a great deal, but it is not there where it can pinpoint the information that we want. So how do I contact NVOQ, whatever it is? And it just gave the website, which is not bad to start with. And then again, we had to dig deeper. And as I said, you had to go through the proper person, because all of these are done by vendors, their sales representatives, because I have dealt with many medical equipments and services, so I know who I need to contact. And so we need to talk to this particular sales representative to get more information on this. So ladies and before I conclude, I said, what are the future possibilities of ChatGPT or artificial intelligence in the healthcare field? He says, personalized medicine. It can analyze your medical data and provide treatment recommendations and outcomes, healthcare costs, all these kinds of things. It can improve diagnosis by inputting the patient's history, medications, existing medical conditions, and the symptoms. It can come up with a list of diagnosis, because it might broaden the knowledge of even like medical students, nurses, residents. This is expand their knowledge, because their knowledge is sort of just evolving. And this may help them to expand their knowledge. Oh, I never thought of that. Okay, maybe let me go look up some more onto that. So if you find a diagnosis that you didn't know, then ask a series of questions on ChatGPT about that particular condition. So in that way, you can just sit there all day long and keep plugging in questions, and your knowledge will just exponentially expand. And that's why this is excellent for writing essays, writing college papers, or for writing a story of history of India from 1000 AD to 2000 AD. It will spit out, of course, it's not going to be really specific, but it's the broad history. And from there you can dig deeper into each ruler's time and things like that. And it can also work as a virtual healthcare assistant. Like there are rural areas where you can't get doctor, you can't get nurses and all these things. And these computer programs can help triage these patients and give them recommendations as to where they can get help, because it can have the data information available in that particular zip code or in that particular area. Telemedicine is another thing I said. And resource management. And resource, when I'm talking about human resource, time and involvement of people is very labor intensive and is expensive. That's where streamlining these things will help. I hope, ladies and gentlemen, this has given you an insight into artificial intelligence applications in the medical field and how reliable they are, where do they stand as we speak, and how it will make a difference in the next decade or so. But the artificial intelligence companies have exploded in the last 3 to 4 years. The stock prices had skyrocketed. Most of them have come down, but I think when the new cycle begins, the artificial intelligence, as it becomes more and more intelligent, the applications are going to be infinite. Not only in the healthcare industry, but in every other industry in the world. Look at Tesla. Tesla, I just was watching a video, it said they have 4 million Tesla cars transmitting artificial intelligence data by minute. And all that information is used to improvise the performance, quality, safety of the next Tesla car. And look where we were before Tesla came into existence. And think of that as an application in the next 10 to 20 years in the medical field, as how beautifully we can fine-tune our medical services, time and resources in the healthcare industry. Thank you so much for watching, and please do subscribe to our YouTube channel. I will see you in the next presentation.